Good morning, and thank you for attending this press conference. I am Marshall Faircloth, Chairman of the Cumberland County Board of Commissioners. I am joined by Mayor Mitch Colvin, Cumberland County Health Director Dr. Jennifer Green, and Mike Nagowski, CEO of Cape Fear Valley Health System. As Chairman of the Board of Commissioners, it is important that I share with you the latest information on what your county government is doing to protect the residents of Cumberland County and to help prevent the spread of COVID-19. Our board has the highest confidence in our county administration, public health department, and emergency management to lead a coordinated county-wide response to this evolving pandemic situation, and in collaboration with our federal and local partners. To achieve this purpose, I'm declaring a state of emergency in response to COVID-19. Although we do not have a positive case of the infection right now in Cumberland County, we are preparing for that day, and this is a proactive measure to ensure that we have the flexibility and resources needed. The declaration will activate the county's Emergency Operations Center for as long as required and authorize the county to take appropriate action to protect the public welfare. This may mean alterations in county services and programs, and we will keep the public updated on any change through the COVID-19 webpage on our website at co.cumberland.nc.us. That's co.cumberland.nc.us, and our social media platforms. If residents have questions about COVID-19, we encourage them to call Cape Fear Valley Health's COVID-19 line at 910-615-LINK. That's 910-615-LINK. In addition, the county has opened a general Cumberland information line to handle calls regarding county services. That number is 910-678-7657. 910-678-7657. This is not for medical information. This is about county services. This is your medical information line, 910-615-LINK. Again, thank you for being here, and at this time I will turn it over to City of Fayetteville Mayor Mitch Colvin.
Thank you, Mr. Chairman. Certainly would like to thank the chairman, members of Cumberland County Commission and the staff, also the staff of the City of Fayetteville, the City Council, and our healthcare professionals who join us today. Unfortunately, we've seen this time before where the city and county, in times of crisis, collaborate. We are using a similar approach as we did previously with the hurricanes to have one triage process to service and to make sure that we push consistent information out to the citizens of Fayetteville and Cumberland County. The chairman shared the contact numbers, which I will continue to reiterate that toward the end of my remarks. But similar to the chairman's remarks, I have signed an emergency declaration order for the city of Fayetteville that will be implemented immediately, that will provide specific instructions as to the direction or to the things that we need to do in this difficult hour here in the city of Fayetteville, consistent with the governor's orders regarding large gatherings in order to prevent community spread and to encourage social distancing. The 100-person or less gatherings that was implemented or recommended by the governor's executive order will also be consistent in my orders regarding city-owned property, assemblies on city-owned property. At this time, we ask that also private businesses who are not covered in this order and the exclusions that have been listed in the governor's order, but we ask for common sense decisions, whether you're a faith-based litter or business. If you have assemblies or gatherings over 100 people in this community, we ask that you would please revisit that approach and make the prudent decisions. At the end of the day, I think that we will only be successful in slowing down community spread of COVID-19 in our community with a partnership with the citizens of Fayetteville, Cumberland County, as well as the local government bodies. At this time, I'll give a few updates as to where we are at this time. with many aspects of COVID-19 from both the citizen and staff perspectives. From the citizen side, again, we are asking that gatherings of 100 people or more in any groups on city-owned property or throughout the city be limited at this time until further notice. From the staff side, we have implemented non-essential business travel, especially related to traveling outside the state of North Carolina, and every travel information voucher that's submitted by the staff of the city will be carefully scrutinized. Right now, we have approximately 25 events scheduled and approved by permits over the next 90 days. Some as small as a few hundred, some as large on larger scales like the Dogwood Festival that anticipates several thousands. And we are looking for them and their boards to make corrective action consistent with the emergency order declaration that has been mentioned, as well as with the executive orders that have been released by the governor's office. And so those boards will have decisions to make as to the rescheduling or the postponement of such events. We're taking a closer look at our parks and recreation throughout the city and the county, ensuring that we do the right thing and we put safety first for our children and for their families. We have told parents of these kids in these programs and our after-school programs to be prepared for decisions that may come in the coming days and at short notice to cancel or postpone any scheduled events. We have also set up a website for easy-to-find services online at City of Fayetteville, FayettevilleNC.gov or cityoffayetteville.org, fayetteville.nc.gov to have the latest information on schedule changes and the city's policy directives. And at the end of the day, we will have complete information. It is our goal to continue to communicate with you consistent and up-to-date and current information so that we can mitigate any false information being disseminated throughout the community, which is very important that you have the facts. So we refer you to the numbers that have been listed behind me at 910-678-7567. Although Cumberland County is managing that line, they will be able to help you and point you in the right direction if you have questions. Also, the City of Fayetteville's website and our social media pages are also good resources for current, up-to-date, and accurate information, which is so important. And as you know, this situation is evolving fast, and so changes may happen on a daily or hourly basis or by the minute, and we'll continue to keep you fully engaged. Tonight at our city council meeting, we've asked CEO of Cape Fear Valley Hospital, Mike Nagowski, who joins us today, as well as Dr. Green, our public health director, and members of WOMAC to brief the city council so that we can share with the citizens the latest information as it relates to COVID-19 in Cumberland County. We are encouraging our citizens who normally attend our council meetings to please join us by television at Fay TV, or it will be live streamed through our social media pages, so we're asking you to please limit your presence at tonight's meeting. All items of business will be fully transparent and communicated through the sources that we provided. So with that, I'll turn it over to Dr. Green and prepare for any questions at the end.
Thank you. I'd like to start out by saying there are no current cases of COVID-19 in Cumberland County. There are currently 32 cases of COVID-19 statewide. There's not yet evidence of community spread in North Carolina. This is a good thing. Consistent with the North Carolina Department of Health and Human Services, we will report any presumptive positive or confirmed cases of COVID-19 on the Cumberland County Health Department website. This information will also be available on the North Carolina Department of Health and Human Services website. The situation is rapidly evolving. We know that pandemics spark fear and anxiety. I want to encourage our citizens to seek the most current and up-to-date information from credible sources. You'll find current information on the Cumberland County Health Department website, the COVID-19 webpage, the North Carolina Department of Health and Human Services website, and the Centers for Disease Control and Prevention website. Please seek credible sources. In an effort to slow COVID-19 and avoid unnecessary strain on the healthcare system, we heard from the governor on Saturday about the executive order to ban mass gatherings above 100 people and the closure of our K-12 public schools. We strongly encourage the public to follow these mandates along with CDC guidelines to practice social distancing. Social distancing means staying at least 6 feet away from people whenever possible. We recommend that people at high risk for COVID-19 stay home to the extent possible to decrease the impact of infection. This includes older adults, those with chronic health conditions, including lung disease and heart disease. This also includes people with weakened immune systems. We encourage all citizens to practice standard precautions, including washing your hands for at least 20 seconds and to use hand sanitizer with at least 60% alcohol when hand washing is not possible. We also recommend not touching your eyes, face, or nose when uncleaned or unwashed hands, covering your mouth when you cough, and then cleaning and disinfecting surfaces that are frequently touched. The CDC does not recommend that people who are healthy wear a mask to protect against COVID-19. Face masks should be used by people who have been diagnosed with COVID-19 or other respiratory illnesses, like flu. Following this recommendation saves critical resources for healthcare workers who need to wear appropriate PPE or personal protective equipment when interacting with patients. If you think that you've been exposed to COVID-19 and you develop symptoms, before you go to the doctor's office, we need you to call ahead. Call your healthcare provider before you go, tell them about your symptoms, and let them do an assessment over the phone. Tell them about your possible exposure to COVID-19 and why you think you might have been exposed. This allows healthcare workers to prepare appropriately and protect our critical public health and healthcare workforce, and protect people that might be in waiting rooms that might also be experiencing illnesses. Please call your healthcare provider before you go into the office. We know that COVID testing is available through the North Carolina Department of Health and Human Services, their state laboratory, and tests are available at this time. It is not necessary for everyone to be tested. We are not currently providing testing at the Cumberland County Health Department. If you do have symptoms, there are some criteria for testing, and those criteria have been expanded in recent days. So you should call your doctor's office ahead of time if you meet these criteria. And these criteria include if you have fever or lower respiratory symptoms, including cough or shortness of breath, and a close contact with a confirmed confirmed case of COVID-19 within the past 2 weeks or 14 days. Or if you have fever and, again, cough or shortness of breath, and you've had a negative flu test, please call your healthcare provider before you go. Your healthcare provider may also have access to COVID-19 testing through a commercial lab. We are encouraging our local healthcare providers to use commercial testing, for example, through LabCorp. And we encourage the public to continue to call the Cumberland Information Line for general questions about COVID-19. Again, that number is 910-678-7657. We want to thank the community members here and the community members in Fayetteville and in Cumberland County for taking important precautions to protect the health and safety of our children and our citizens. I appreciate the work of Cumberland County Health Department staff, our healthcare community, and our local response partners for the important work that we're doing to stop and slow the spread of COVID-19. At this time, I'll turn it over to Mr. Mike Nagowski.
Thank you so much. I'm not going to repeat all the very important information that the previous speakers gave. What I will do is talk a little bit about what the health system has been working on. I want to thank everyone who's here and is working to get this information out to the public. It is a significant and serious public health issue, and I'm grateful for all the communication that you all are providing. At the health system, we've been monitoring this situation since January. We actually now meet on a daily basis to review information, get the latest guidelines from the CDC, and find out what's happening not just here locally, but across the state and obviously internationally. We have conducted more than 10 tests ourselves. We have no confirmed cases, but we fully anticipate that we will have confirmed cases. We may learn as early as tomorrow that we have a confirmed case here in Cumberland County. One of the cases that was confirmed in Harnett County was confirmed through Health Pavilion North. So one of our facilities did the testing and it was sent to the state, and it is a confirmed case. It is a patient that is now self-isolated in Harnett County. Believe me, it is just a matter of time before COVID-19 is in our community. Internally, we have restricted all travel for our 7,800 employees. We have placed significant visitor restrictions. Currently, we allow no more than one visitor per patient, and we are under conversation about what we will have to do if we have to get to a position of allowing no visitors to the hospital. Again, if you believe that you've been exposed and you are experiencing the symptoms that were described, fever, significant cough, please do not hesitate. You can call 910-615-LINK, which is 5460. So 910-615-5465. We man CareLink with registered nurses. All of our scripts, all of our screening are in complete compliance with CDC guidelines. We are ready to answer your questions. If you are deemed appropriate, we will most likely send you either to the Highsmith-Rainey Urgent Care to receive swabs to be sent out for testing, or we may actually send you to the Cape Fear Valley Medical Center Emergency Department. It is highly likely that if you are sent there, we will instruct you to call when you arrive, to not simply walk into the facility. It is highly likely that we will send personnel in the appropriate garb out to your car where we will swab you in your car. It is designed to keep our healthcare workers safe and also to reduce the chance of spreading the virus. My children are highly tuned into social media, and one of the images that I'd like to share with you is this image. I think it speaks volumes to how we can prevent the additional spread of the virus. This is an image that they're using in Greece, right? If we can break the social distancing, if we can keep social distancing in place and break the chain, it will go a long way to keeping our community safe. I want you to know that this impacts us all on a very personal level. In my house, I have my 73-year-old mother-in-law living with us. I love my mother-in-law. I'm happy she lives with us. I saw the look of a few folks. But I also have a 12-year-old child. And I was actually very impressed that the governor and the Cumberland County School Board decided to withdraw students from coming to the schools. Because while it is easy enough for us to self-quarantine my 73-year-old mother-in-law, a child who goes to school may be exposed. What is one of the very first things she does when she comes home? She goes over and she hugs her grandma, right? And the last thing we want to do is have folks who are at great risk being exposed, potentially being exposed. So again, thank you to all of the citizens of our region for doing the very best that they can to reduce the potential for spread.
Thank you, Mike. Before we turn it over for question and answer, I see Commissioner Jimmy Keefe in the house. I see Registered of Deeds Lee Warren. I saw Willie Burnett, Mayor of Godwin. I see Glenn Adams, County Commissioner. And we are practicing social distancing, so we just ask to keep the podium as sparse as possible, and that's for everybody's protection. At this time, we would like to ask our Health Department Director and our hospital CEO to allow questions from the press.
I thought I heard you say, and I wanted to clarify, that the state of North Carolina, there has not been confirmed community spread.
Right, we heard that from Dr. Cohen on Saturday. There was not yet evidence of community spread in North Carolina. That was as of Saturday. So we know, again, the situation is rapidly evolving. So community spread is, we might not know, there might be a case in Cumberland County or another county where we don't know where that person became infected, and then we think about that as community spread. So the cases that we do have been associated with travel, or we have known links to where that person might have been infected.
If you allow me one more question. And of course, this is a fast-moving situation.
Yes.
The CDC has issued a guidance that we should have gatherings of 50 or fewer people.
Yes.
Have we had any communication from the state that the state may come into line with that, and I guess for local officials, can we do that ourselves locally? Limit gatherings to 50 or less.
Correct. So last night, the CDC released additional recommendations to avoid gatherings of 50 or more, or 50 or more. So we have not heard yet from the State Health Department about changes to the governor's mandate, but we work in regular communication with them, and we'll certainly communicate that to our response partners here, our city and county officials, if we do hear any updated information about this from what's coming from the state guidance.
There seems to be a lot of panic.
Let me go ahead and call on Gilbert. I saw his hand just a moment ago. Now, I'll get you next.
So, we've been down this road with hurricanes and with flooding, but at some point, the wind stops blowing and the rain stops falling. Dr. Ring, both you and Mike have said there are no confirmed cases, but as I'm streaming this here, I see people saying there are cases at the hospital. I have someone who works closely there, and they know that there's someone there. Would you explain to folks that what is the value, if any, of health officials here in Cumberland County hiding the fact that we have cases? You would want to let the public know that as quickly as possible. Talk about that.
We will absolutely let the public know if there are any confirmed or any presumptive positive cases. I want to encourage members of our public to seek sources of credible information. We know there's a lot of rumors going around, and when we have the rumor mill spinning, it prevents healthcare providers, it puts them at risk. So we will absolutely, it serves our best interest if we report it quickly to the public if we do have any confirmed cases. So we'll absolutely report that immediately.
Absolutely. It does no one any good to hide that kind of information. It's important. The moment we have a confirmed positive case, we will let the community know.
Okay. You had a question on the end?
There seems to be a lot of panic amongst residents. We've got food flying off shelves. What are your words to residents? How can you calm us?
We want people to know that their local health care providers and their local health department and emergency management and our school districts, we're working together closely. We have regular conversations about how to respond to this. This is the work that public health does. We train and we exercise for these types of events. We hope that they don't happen. And we're in a little bit of unprecedented territory here, but this is the work that we do. So we are prepared to respond, and we'll continue to work with the state health department.
And I would like to just add, remember, while this virus is serious and we should all be concerned and we should all do our part to prevent the spread, the people most at risk are the elderly, people with compromised immune systems, or those people who already have some other illness. If you are not in those categories and you contract this virus, what our knowledge is at this point is that you'll be sick, but you'll recover. You will recover. Many of us in our community ourselves have had flu or other types of illnesses that we've recovered from. So I think, it's important for people to realize that even if you do contract COVID-19, the data is clear, you will most likely recover. It is a small subset of our population that are truly most at risk.
Right.
As we talk about testing and stuff like that, can you kind of tell us what our capabilities are other than LabCorp or anything like that?
So at this point, none of the hospitals in the state that I'm aware of have the distinct capability, and there is no recommendation that they do the testing themselves. So at this point, there are state facilities that are doing the testing and commercial organizations like LabCorp and Quest that would perform the actual testing. We have collection kits at the health system, and again, if you call the 615 link number, we'll direct you as appropriate to receive that collecting procedure. Mr. Kirby?
I got Steve next.
Oh, I'm sorry.
Yeah.
I'm sorry.
Then-
Continuing on the testing, first, you said there's 10. Are those just from Cape Valley, or is that total in the county? And do you know how many are in the county? Also, regarding the testing, understand that at least one positive person was sick for a good while, and they said they wouldn't give the test until the person had a fever, and he tested positive. Is there any thoughts to open up the testing
So I can speak to the criteria for testing. So the state health department expanded the criteria for testing to include people that are symptomatic and that are negative for flu. We do know the state does have a limited capacity for testing, but we want to make sure that those that are symptomatic and are negative for flu have testing available to them. We also want to what we're not doing is testing for people that don't have symptoms and don't have a travel history or exposure that would suggest they might have contracted COVID-19. We cannot share from the health department the number of testing that we've done. Again, we will absolutely report any positive or confirmed cases. But it's also important to us that we protect at the health department the privacy of individuals. And so we are only reporting positive cases or presumptive positive cases or confirmed positive cases at this time.
But you have to have a fever and a negative flu test?
So you have to have symptoms, so fever, coughing, or shortness of breath, and a negative flu test, or you can have fever and coughing or shortness of breath and some known exposure to a positive person. So if you know somebody that was exposed and you were also exposed, then we could do testing for you.
Is it possible to first test negative and then test positive later? Or do you know?
So you can, if you have so first we're going to do a presumptive positive at the state laboratory, and then we will do a confirmed positive at the Centers for Disease Control and Prevention. So presumptive is when it happens at the state lab, and then confirmed is what happens when it happens. Confirmed is what happens when it goes to the CDC. So if you don't get a positive at the state lab, then you're not going to go on to the CDC.
You're not going, you can't be tested.
You might have been exposed later. So if you test negative and then you're still having symptoms, we want you to give us a call back.
Okay, Jeff and then Bill.
Mr. Pregowski, you have roughly 40 beds at Highsmith Brady Specialty Hospital, which is primarily for geriatrics, if I understand what you do there. They're probably full most of the time, are they not?
We have 66 acute care beds at the Highsmith Rainey long-term acute care facility, and we run an average census in the mid-50s. So normally, we hover right around capacity at the Highsmith Rainey facility.
So what if we do have a community breakout of some sort? Cape Fear certainly stays full most of the time. You turn ambulances away sometimes. That busy emergency. What do we do? Where do we find the extra beds?
Great question. There is no doubt the medical center is one of the busiest medical centers in the state. The ED is the single busiest emergency department in the state of North Carolina and one of the busier ones in the entire nation. If all of a sudden there is a huge breakout and hundreds of additional beds are needed, we have made ancillary plans. We do have beds at some of our other facilities that are not occupied. There are beds in our Bladen facility, there are beds at our Hoke facility, and there are beds both at our Betsy Johnson and Lillington facilities that are available. So we would be able to accommodate additional volume. But remember, hospital beds are really there for people who have complicating factors. If you are diagnosed with COVID-19, and as I look around the room, if many of us in this room were diagnosed with it, we probably would have you self-isolate at home, right? The beds, especially isolation rooms or intensive care, are going to be reserved for people who are in a category who absolutely have to have additional care.
And we will, at the health department, if you were a positive case, we would assist you with that isolation. So we're going to talk you through what isolation means for you and what that means for your family if you have additional children or pets in your household or family members, in particular those who are high risk. So we will talk you through that, and we will give you some resources about how to self-isolate.
If I may, Mr. Chairman.
Sure.
In the event something develops community-wide, we have a relationship in Fort Bragg who could provide temporary tent hospitals and the like, should that be needed.
I'll defer to the medical professionals because they have a close relationship with them.
We work regularly with the Fort Bragg Department of Public Health. I won't speak to what they'll be able to provide in this particular scenario, but we are in regular communication with Fort Bragg and Dr. Colonel Bedno on a regular basis. And so if we already have an understanding that if there's a positive case at Fort Bragg, we will notify them. And we already have a system in place that if we have a positive case, that's military affiliated, we will notify Fort Bragg as well.
Okay, Bill, and then back to Gilbert.
Dr. Nagowski, did you say you may have a positive case tomorrow?
That's correct.
Can you expound on that?
We have swabbed and collected material from a patient, and that material was sent off to a lab. The criteria for that suggests that it is possible that we will have our first case, our first confirmed case.
Okay, Gilbert?
When do you think you know tomorrow?
It's hard for me to say, Bill. We do expect that we'll hear something on that particular case by close of business tomorrow.
Since this is a media conference and these cameras are rolling, and if that test comes back negative, you'll report that, obviously.
We are typically only reporting out positive cases because we have had a number of negative cases. But if someone were to call us, we would confirm that we have no confirmed cases.
Okay, Gilbert?
So they have to call you to find out whether, because of this.
What would be the best way to communicate that? How would you like us to do that?
Just follow up on just what's been said in the room today.
We can do that, yeah.
Proper way. People are gonna see how this press conference has transpired, and now they're gonna be talking, because you say that there may be a problem. They're gonna wanna know,
Right.
and I'm gonna wanna know.
Absolutely. And I think as a community, we should be prepared. We will have a positive case. It would be really a unique situation and a very fortunate situation if we don't. We are preparing as a health system that we will have positive cases. And we've made the commitment, the health department's made the commitment, that the moment we identify someone who is positive, we will let the community know. The community deserves to know, and the community has been fabulous in helping us coordinate our response.
So,
Okay, Gilbert?
so I want to switch it back over here to city and county. We talked a lot about the medical aspect. Right now, businesses are really hurting because of what they're being required to do. What are you hearing? What is the plan as we limit folks going out to different events and events are being canceled, which have a ripple effect throughout the community? You can't go to the prom and all the folks who are doing what they have to do. What's the plan? What's the thought process here as we move through this?
I'll hit it first. It's a matter of safety first. Safety first and above all else. We're following the governor's guidelines, and frankly, I don't think sheriff deputies are going out and closing anybody down. But the guidelines are there, and I don't want to be the person that has a gathering and a dozen people go away from there with exposure. That's not something I'd want to do. So until further notice, once again, it's safety first.
From the city side, we have talked about, of course, we understand that this is a lifestyle change, but as the commissioner, as the chairman said, that the public safety comes first. We did talk to the city manager this morning. We'll be having a little further detailed discussion with council about some of the things that we can do. A call I was on earlier in the week talked about reappropriation or use of block grant funds for safety measures concerning the elderly. So we have staff looking into that from our community development to see if there are resources available. Any state and federal resources that come down, we had talked about from a preliminary basis, if there are some things that we can do to kind of help the economic engine get started back after this is over. But right now, until we get past this portion of it, I think safety is the first concern. We can always, claw our way back from an economic perspective for our small businesses, but we're definitely conscious of the sacrifices that they're having to make right now.
And what about, seeing a lot of talk about children in terms of, how do we handle kids who, I know the school system's doing some stuff about food, but you have kids now who have to shelter in place. They can't go to the Boys and Girls Club. That's
once again, I'll take the first shot at it, but I think you're going to hear quite a bit from the school system within the next 24 hours. They are very much aware that there are parents with kids at home, and the parents may be home as well. I know they're talking about putting together a way to feed kids who may have been reliant very strongly on breakfast and lunch at school, and the parents are not prepared for kids to be home. So there are a lot of things in place, or will be in place from that standpoint. The county's declaration of emergency is not to alarm people. It is so that we can put our emergency people in the places where they need to be, and so that when funds are available from the state or federal government, that we're in line to get our share. So not to panic anybody, but to absolutely be as proactive as we possibly can.
And from the city's perspective, I think that the most important key to all of this is the communication between the county, the city, and the school systems and the healthcare system. And so as the school system, of course, we'll defer to the school board and Dr. Conley to make a decision about it, but we're here to support in any way we can, whether it is utilization of our centrally located rec centers or some other method to help with these food insecurities, which are a big part of what's going on in our community for a number of people who are in the school system.
Did y'all drop down to 50, or are y'all limited by what you go?
It's strictly governor right now, but we're recommending 50. We're doing 50 from a county standpoint. We've asked people. We have, like the city, we have a commissioners meeting tonight, and we're asking people not to come if they don't have actual business here tonight. So that's we're reserving 50, even though the governor has not yet changed his guideline. Kayla?
These are probably for Mike. Are there any concerns of healthcare staff shortages? How are healthcare workers handling this? Are they worried about their own families? And any special considerations for people who have to stay home to care for their kids who are out of school?
Yeah, absolutely. We've been monitoring that situation. I was actually on the phone this weekend with the superintendent about the situation. To give you an example, we employ about 2,000 nurses, right? And many of our nurses have children. And as the school system's custodial service has stopped, we're concerned about the impact on our own workforce. So over the weekend, we arranged so that we have greatly expanded our own daycare capabilities. We typically have about 150 children of our healthcare workers that we house and care for on a daily basis. And so we've made accommodations to grow and expand that, and are getting that communication out actually as we speak today, so that the last thing we need is for 20% of our workforce who are direct patient caregivers to not come to work. We're a very busy medical center, and we need all those healthcare professionals to be there. So we're using our properties, our healthplex, our conference rooms to be able to accommodate children of our employees so that they can come to deliver the care that our community is going to need.
Jeff?
Do you have the capability through your state of emergency to free up funds that ordinarily would not be available in a situation like at the state and federal level, so you can apply it to other things that you may not be able to anticipate? Overtime for employees, food needs for those who can't help themselves.
Well, from our end, anytime we declare this, it gives you the ability to start tracking, overtime and different things that are reimbursable from the federal level whenever the time comes. But I'm sure the city manager and staff are very thoughtful and are in close communication with the federal and state officials as to what can be used to make sure that we're in line to get reimbursed. But right now, it's safety first, and so this is why we operate in a way that we have reserves, so that when you have unforeseen emergencies, that you can do what needs to be done. But certainly we'll be in position to ask for reimbursement, and that's on the city side.
So you do have funds set aside for that purpose?
For any unforeseen emergency purpose, yeah.
Myron?
Question about respirators. Obviously, if someone does fall into the category of being more ill and needs additional care,
from the healthcare system side, we do not have an unlimited number of respirators or ICU beds or isolation rooms, which is why we're adhering to the CDC guidelines. We feel as though we are well prepared over the short run, and we are working very closely with our suppliers. If we're anticipating a 60 to 90 day time frame that we've got to be ready for. So all of our PPE, all of the gear, the equipment that our staff needs, we feel like we have that in supply now. And we're working, if this goes beyond the 60 or 90 day, or if all of a sudden hundreds or more of people need this, we're actively working on those backup plans, those ancillary plans.
And similar, we are in close contact with our local emergency management and state emergency management. We have a current supply for our staff, but I want to remind the public that to only use face masks and other personal protective equipment when it's needed. When the public buys those items in mass, it creates shortages for our healthcare workers. So I want to encourage the public. I know there's a lot of fear and anxiety, but those are needed for our healthcare workers. So if something were to happen or this extended long-term, we are in close contact with our emergency management, and we have a way to request critical resources, including personal protective equipment, from our local emergency management through the state system. And we know that the state health department has a small supply that they also have available, and we would request if needed.
There actually is, at the federal level, something called a strategic national stockpile, and we've been in contact with our representatives at the federal level to better assess what their capabilities are to get that to us and what timeframes, might be involved.
Can I squeeze in one question to the mayor?
Sure.
And I'll hush. You had mentioned, Mayor, that people who have scheduled events that are larger than, 50 or 100 should reconsider. Are you including the Dogwood Festival in that number? It's in April, but should that be one of the institutions or organizations that should reconsider?
Well, absolutely. I think at the end of the day, all situations are on the table. If you look at the CDC's recommendation, it was 50 or less gathers for the next 8 weeks, which would certainly encompass that. I did hear from the city manager just a few moments ago that the board decided to postpone it, and new dates will be rescheduled or mentioned at some time. But at the end of the day, anytime you have a gathering that large, it certainly increases the chance for negative impact.
Okay, I don't see any more hands, so at this time, I would ask Mayor Mitch Colvin for a few brief closing remarks.
Thank you, Mr. Chairman. Thank you, Dr. Green and Mr. Nagowski. And thank you to the citizens of Fayetteville. I think you've heard today, the main goal is to make sure that you're informed and educated. We're not asking you to panic, but we are asking you to be prudent in your decisions and to work with us. As you heard reiterated a couple of times, that our healthcare system is vulnerable to any mass outbreak, so we need your help to control and contain this. And we're asking that you please follow the recommended direction of the state, federal, and local government agencies to make sure that our community is safe and taken care of. I'd like to also say that Action Pathways is a organization locally that is helping with alleviate some of the food insecurities that exist, and so they're looking for volunteers or help for anyone who wants to be a part of helping to make sure that our children are taken care of during this time. That's a great alternative. Also, we ask that we continue to remember about the social distancing piece, even if you're in smaller numbers, that you try to keep a 3 to 6 feet radius between you and most people when you have the opportunity to do that. But I'd also like to mention that I'm joined here by some other mayors. I see Mayor Warner of Hope Mills, Mayor Burnett is here, and also Council Member Banks McLaughlin is here. And so we'll get through this for our community. We've been here before, but right now we'll need all hands on deck, and including public participation, to be successful. So thank you.
Thank you, Mayor. And once again, I'll reiterate the phone numbers for medical information: 910-615-LINK. And for general questions about county government, and you can call this for city questions as well, and we'll refer those to the city. 910-678-7657. And at this time, we thank you so much for your time and your attention. Ray, you got one more question? Yeah.
How about the courthouse? Are they gonna change their procedures and stuff like that? I heard.
Check the Cumberland County website, and let me get back to that website right now. It's co.cumberland.nc.us, and that will give you updates on what Cumberland County is doing. So at this time, we thank you, stay safe, and our prayers are with you.